Good. Hey, Ashley, I'm JD. I'm going to be your physical therapist this afternoon. How are you feeling?
Good, how are you?
I know it appears like you're not getting enough sleep at Grady Hospital.
Yeah,
That's what we do to our patients. We don't make you sleep. So hopefully you want to be going home tomorrow, right? I know with all the blood work, all the technicians are coming into your room. We apologize about that, but I know we need to monitor you on a constant basis to make sure that you're recovering pretty well. All right. So I have an order to get you out of bed. You had a surgery done yesterday. I know. I'm probably the last person you want to see, right? But I promise you I'm going to be helping you along the way. I'm going to make you really strong, and hopefully tomorrow or day 3, we can discharge you at home because you have a good support system, all right? So it looks like you had a knee replacement done on the right side, right? That was done yesterday. You're probably going to be in a lot of pain. That's expected, especially when we move you. I'm going to be helping you, all right? We're going to be assessing that pain level. Do you remember that you have to put this on? That I have to put this on you? Do you know what this is? So we call this knee immobilizer. So the reason why we have to put a brace into your knee, they did an epidural block, a femoral nerve block during surgery. You probably had this explained to you before the surgery. So to make it more of an ease for you during the surgery, they have to do that. And because of that block, this muscle is not working the first few days. Hopefully tomorrow you will have more functioning. We call that the quads. So the reason why we have to put this on when we get you up in a standing position and walking, we don't want you to buckle.
Okay.
So when I'm done with you, I'm going to leave this on. But if the pack is getting you up tomorrow, if you have to go to the bathroom, this needs to be in place, and they should be able to put this in. All right, that's one. Secondly, you have your shoes on, you do? I'm going to put that closer to me, so I don't remember. And then, secondly, the doctor said you could put as much weight as you can on that right leg. The weight bearing is tolerated. That means you could actually bear weight as much as you can without causing too much pain.
Okay.
For the first few days of the surgery, I will allow you to not put 100%, but part of the healing process is to be able to load that knee again, and hopefully we get easier every single day. That makes sense?
Yeah.
So questions for me for now?
Is it gonna ruin anything if I put weight through it? Oh.
You let the pain be your guide.
Okay.
Yeah. So as I said, as tolerated,
Okay.
and then you can always undo the weight if it's causing too much pain.
Okay.
But the more weight you put in, is better.
Okay.
All right. So before we start with our process here, I'm going to check your vitals. Do you remember your everything is good from the nursing station? Do you remember your blood pressure reading before? Last time?
117 over 70.
Oh, that's perfect.
Something.
So let's check that today to see if I can get that for you. All right. I'm going to check it on your left side. Can you just check your pulse for me? Can you do a muscle for me? Don't let me extend your arm. And relax. Like clean up my stethoscope already. Just lift it up. Hold the heart. Two over 50. And then the way it's gonna work, right? I'm gonna check your vitals, and then I'm gonna be performing what we call a probability examination to just see how much you can move your arms and your legs. I'm gonna check your ability to be able to activate your muscles because that gives perspective in terms of your transferability. And then exercises itself, make sure that I can actually give you something to encourage you to be able to be independent yourself, and then eventually we're gonna make you walk. And then I'm going to put you back in chair.
Okay.
All right? Expect probably 20-30 minutes. All right? But as I said, it's going to guide you along the way. Can you turn your head for me to the right side, please? It's going to be checking your pulse. 30 seconds. respiratory rate is always low too. What's your last respiratory rate? I'm just curious when they checked it. You don't remember?
No, I don't.
It's 14 breaths per minute. So I was able to check your breathing ability. That's normal. And then I check your pulse. It's 58 beats per minute.
Okay.
So that means you're gonna be okay to get out of bed.
Okay.
All right. So those are all good. And then the first thing I want to do here. Do you have an underwear on?
Yes.
Yep. I'm just gonna be lifting this a little. Just see your. I see you have that ace bandage around your right knee where you have the surgical like this. All right. It looks good to me. I'm gonna lift this up a little higher. And that's high enough. Any pain here? I'm gonna put my fingers under your calf area.
No.
And they feel symmetrical. Nothing, right? Okay, let's start with your arms first, all right? Everything looks good here. Can you lift your arms up for me as far as you can? And then down. No pain?
No.
And then can you move your arm out to the side like it's an angel? Like while saying, yep. Any pain? And then down. And then are you right-handed or left-handed?
Right.
Can you squeeze my hand for me? As much as you can. Very good. So the mere fact that you could do that, the walker that I'm planning to use with you should be able to grip it later, all right? And then can you flex your elbow for me and then extend them, all right? And then I'm gonna check your left leg first, all right? Can you flex your hip and your knee towards your head? Yep. And then back. And then can you move your left leg out to the side? And then back. Can you lift this leg up towards the ceiling, straight up, and then down? Very good. And then move your left ankle towards your head, and then down. Very good. And then I'm just gonna check something here. I'm thinking about it. Check your pulse. You have full pulse right here. That's normal. And that's good to me too, right? So with this, I know it's going to be painful, right? I want to get some benchmark on how much you can bend that knee, all right? I'm going to help you. So gently slide your heel. And I'm just going to pretend that you stop there, all right? And then I can measure, all right? So it looks like you're sitting at 90 degrees. Miracle already. Okay. Yeah. You had a good surgeon. Yeah. Yeah. You can lower them. Yeah. Usually you don't get that number in the first few days, all right? So you have 90 degrees, and then I'm seeing you're not able to extend them all the way. That's expected because you're in so much pain right now, right? Hopefully that's gonna get a lot more easier. All right. And then let's do this. Let's do the activation patterns first, all right? So hold your arms this way for me, midway. I'm gonna push it towards your head, don't let me move you. Hold it, hold it, hold it, don't let me move you down. Hold, 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 don't let me move your arms up to the side. Hold it, hold it, hold it, and then don't let me squeeze your arms in. Hold, hold, hold. Now flex your arms for me. Don't let me extend it. So that's good, that means you could push up from the walker later. Don't let me extend it. Don't let me flex you. Very good, and then last but not least, don't let me move you in again. And then out, right? Now flex in, flex your hip and your knee for me again. I'm gonna try to extend you, don't let me do it. Hold it. Don't let me flex you. And then straighten them up for me. Don't let me move it out to the side. Hold it, and then let me move it in. And then your ankle, don't let me push it. Don't let me pull it. Very good. And then ankle here, don't let me move it down. And then here, all right? And then I could do, this muscle's kind of probably weak right now. I'm gonna put my hand under your knee, all right? I'm gonna see if you could actually contract that muscle as you're pushing your leg down towards my hand, all right? So it's like a squeezing of the quads. Go for it. Go ahead, squeeze them. You can actually, it's hard. So you cannot contract it. So you're not ready for that. That's fine. You're paying us attention, I love it, yeah. And then, somebody just look at it. I got your strength, and then, last but not least, all right, close your eyes for me. I'm gonna move your big toe. Let me know if it's pointing towards your head or towards me.
My head. My head.
And then,
You.
very good. And then last but not least, I'm gonna check your sensation, right? you, with your eyes closed, I'm gonna sweep your arms and then your legs. Let me know if they fold the same. All right? Bless you.
Just the same. 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 Same.
So outside you. Okay.
Same.
Inside.
Same.
Outside the leg.
Same. Same.
And then the bottom.
Same.
Very good. You can open your eyes. Yeah. So the first one that's really hard for you to do before is the quadriceps. All right.
Mm-hmm.
So let's do this. I'm gonna put my hand under here.
Mm-hmm.
I'm gonna want you to flex your ankle and foot. All right. This is the first exercise. I want you to fire that muscle. Gently squeeze into my hand. I want you to count 5 seconds. Can you count for me?
1, 2, 3, 4, 5.
And then relax. Can you do another one for me?
1, 2, 3, 4, 5.
So the reason why I want you to be able to like learn how to reactivate that muscle, as I get you up, we do the knee brace before, it's going to be helpful for you, but eventually mine is this. I don't want you to buckle.
Oh, I love
That'll be bad, right? You're going to wind up falling. So we're walking with a walker, eventually, without the knee mobilizer, we're hoping to get that functioning back and be able to like kick back, all right? Eventually too, I'm going to teach you another exercise here. Is straight leg raise. It's probably not going to work on the other side. You can contract that muscle, just lift them up and then lower them, all right? You can do kind of that. Very good. And then remember the ankle movement up and down? You should be able to do this, all right?
Okay.
The reason why I'm checking your calf muscle before, I don't want to scare you, you can have a blood clot formation. That will be bad. Yeah. Say that again. I don't want you to have a blood clot.
Oh, I thought you
Yeah,
said
you don't
I
have
had
a
a
blood.
blood
No, no, no,
clot.
no, no. I'm
Okay.
checking if you have a blood clot,
Gotcha.
but you don't have it, right?
Okay,
Like
okay.
you're clear. Or else I would have called the nurse saying, yeah, right.
Gotcha.
But this exercise is going to help you in preventing getting that blood
Okay.
clot, all right?
Okay.
And I know it sounds bad, but we have patients in the past where they just like being so deconditioned, and that could be an embolus if they're lung, and that'll be bad, all right? And then last but not least, can you, so you have this big muscle, your glutes, right?
Uh-huh.
I'm gonna put my hand there, is that okay? I want you to squeeze them together, all right? That's gonna be helpful with your transfer. Hold that for 5 seconds. 5, 4, 3, 2, 1, and let go, all right? And that muscle is also gonna be useful for walking and then the transfer before, all right?
Okay.
Sound good?
Yes.
So let's put in the knee mobilizer,
Okay.
all right? So with this, I'm gonna be helping you, all right? So, can I sit? The top one needs to go into the thigh area, all right? If you do it this way, that's bad, all right? So I'm gonna refold it this way. I'm gonna roll a little. The underwear on, right?
Yes.
Assessed that before. Since you have no functioning, I'm gonna be helping you, all right? So let me lift your leg up. And then that hole in the middle corresponds to your kneecap, right?
Mm-hmm.
So I'm gonna set this up for you. Sure, there we go. Come a little higher. A little more. Perfect. I'm gonna start at the top portion, right? This is gonna be good for protection, right? It's not quite the right size for you. Should have checked that. It's gonna help you with the walking, right? So let's do it that way, and then just assume that's split there, right? And let's click on top. And the bottom one is fine. So we'll put that in and have your sleeves on. And then this way, all right? Well, you're very stable there. Let me line up the walker. Ooh. They do it reverse. Sorry about that. Like your shoes.
Thank you.
Made it easier for me. For volunteer before I have to like struggle with medicine. I'm just gonna filling for your bone here. I'm gonna make it a little higher for you, right? Have you used a walker before?
No.
Okay, I'm gonna show you how to use this, no problem.
Do I have to use it forever?
My goal is for you to be able to like walk independently.
Okay.
So hopefully the progression is walker. You have stairs at home, I'm gonna have to retrain the height of stairs and then eventually cane and then no device.
Okay.
Alright, because I don't want you to be falling, alright? So the way it's gonna work, see my back portion of the walker, you need to correspond there, alright? Not too far forward, not too close to me, alright? A lot of times patients will do this, I don't know why, because you got wheels, because you need to push them, alright?
Okay.
So you're gonna be moving it, walker forward, surgical leg first, which is the right side, and then your left leg, alright?
Okay.
So 3 points, walker, right leg, and then left leg. Can you repeat that for me?
I'm gonna push it on the ground,
Yep.
and then I'm gonna push the walker forward, and then move my bad leg, and then my good leg.
Yep, perfect. And then I'm gonna have the gate all in place later, alright? Just assume that the nursing said they could count it for you, so we're good with the IV because I wanna be able to like walk these steps we do today. That's
Okay.
the goal, right?
Yes.
Because hopefully we could discharge you tomorrow if you are doing well here. And then your breathing is okay, right? Right now?
Yeah.
We just put that on the side.
My husband has oxygen at home.
Also, you don't have like more lights. Yeah. You still buy cigarettes for him? That's really not a good habit. If I were you, I would not do that. Yeah.
I know, but he's
Yeah.
just so unruly.
Yeah. I bet you buy a lot of gum too, right?
He likes the nicotine.
Yeah. So bad. I can't even like make it straight. What we're gonna do next, alright? Let's go back to the programming. We're gonna get into a long sit position, right?
Okay.
You're gonna contract the abs because
Okay.
it's working really well and you have good upper functioning, alright?
Yeah.
I count of 3,
Okay.
you're gonna long sit. I'm gonna get into your neck. 1, 2, 3, up. And just support yourself first. I wanna make sure that. And you alright? And then I'm gonna adjust your bed here. Your left leg is working really well, right? We're gonna
Yeah.
pivot your right hand, but be supporting your right leg, alright? 1, 2, 3. All the way, got it. And all the way. Perfect. And just drop it there. I'm gonna put the gate belt on you. Just engage, alright? Feeling okay?
Yeah.
Don't want to expose your back.
No, we don't.
Don't do that.
The nurses might like a show.
And then it's gonna make it a little tighter, right?
Okay.
That feels okay?
Yeah.
And then all the attachment is good. Your catheter is working fine. It's not full, right? Your catheter is fine. But the way it's gonna work, you're gonna have this walker, right?
Mhm.
In front of us. I want you to push up from the bed.
Okay.
And then as soon as you push up, I'm gonna help you, all right, with the gate ball. One hand at a time, you're gonna grab the walker, and then you're gonna walk towards them.
Okay.
Door. Ready? 1, 2, 3, up, and then pull that right leg towards you. Yep, you got it. And put it down for me. Remember, as much weight as you can. Just relax your shoulder, right? Bring the walker forward, right, and then left. And then start turning for me. Just watch that outlet there. And that way. Perfect. Feels okay?
Yeah.
And just relax your shoulders. Yeah. And then start turning to your left, your stronger side, with the walker. Very good. And then see that chair right there, we're gonna approach that. And then I need you to turn slowly. I need you to make sure you can feel the chair at the back, to feel the back, right? Kick that right leg forward first though, alright? Because it's not happening. So just lower the phone. And stay there. Reach behind it. And then the other leg. And then sit slowly. Right? And reattach that. It's not the right size for her. She doesn't skip like this. Quads and
Yeah, I used to work as a PT.
Lower that for me. All right, so let's just assume that that's actually in place. All right, let me. Let's not that again. Yeah. Take that out of here. Just assume that that's back. All right, in place. The IV pull. And put it closer, of course, and then let's see the oxygen. Attach that again, right? I'm gonna get that gate built. I'm gonna have my tech guard you, because I need to get some equipment. Right? I'm gonna lower that equipment. So you're safe there. I'm gonna check your blood pressure again, right? One more time. You feeling okay?
Yeah.
Did very well with the walking. I'm expecting that to be less distance, so maybe we can double your distance tomorrow, and then we can do the stairs, right? It's weird perspective for us, and then you can go to the bathroom with some help.
Oh, wow.
So, right, yeah, we don't need all the help, right? Yeah. Over 58, that's perfect. And then I'm gonna check your pulse again, to see if that is normal for the whole minute, right? So you can get one well. So first things first, what are the 3 exercises we did today? Can you walk me through it?
We pumped my ankles.
Yep.
For to where I don't have an embolism.
Yep.
And then.
Actually, let's do that. To just like move your blood around the
to
area.
move
Yeah,
my- okay,
yeah.
to
Also,
move
that's a
my
good.
blood.
Yeah.
And then we did the butt squeezes and the leg raises.
Yep. And the all preparation for walking and
Yes.
transfers, right?
Yeah.
And then what do we establish about the knee mobilizer? They
It
need to
has
be.
to stay on.
Yep.
if I move.
I know it's not right now. We're gonna get a better size one for you because I want it to be supportive, right? So every time you walk with a walker, that needs to be in place.
Okay.
And then later, if they transfer you there,
Mhm.
they could actually remove them, all right? I have a call bell right here next to you, all right? You can just like bring that if you need something, all right? I'm gonna write down all the exercises for you. I have my number right there. Do you have any questions for me?
No, thank
You
you.
did very well.
Thank you.
I'm gonna see you again tomorrow. Hopefully get you out of the
Sounds good.
hospital, all right? Nice to meet you.
Nice to meet
Thank you.
you. Thank you.
Yeah.